Bruce Wilkins here at your Belfair Learning Center and a part of your golf, health, and fitness team. Introducing the second part of our three-part series we're calling the replacements. And today we're going to be talking about our hips. All right, so first we're going to learn more about the hip joints themselves. Then we're going to learn how to strengthen and condition our hip joints. And then we'll come back and I will share with you some workarounds if we may have some limitations or injuries in either of our hips.
Hello, my name is Jessica Galasso and I am one of your physical therapists here at Belfair. Today we're talking about total hip replacements. So hip replacements are performed because of damage done to the hip joint. It typically presents with lateral hip pain that might radiate into the groin or into the buttocks. It's usually difficult to stand, to walk, and you'll usually have pain after prolonged sitting. So with this, when you have those symptoms, you'll go see your orthopedic surgeon. They'll take x-rays and then decide if you're a surgical candidate. When the surgery occurs, they typically replace both parts, but they might only do a partial hip replacement. And all that means is they're looking at the hip joint itself, which is a ball and socket joint. So you have the head of your femur, which is shaped like this, goes into the socket for the pelvis. So they might replace both or they might replace one. Typically it's both. The same day of surgery, you will be up and walking on a walker as long as everything goes according to plan. From there, you'll typically have 2 to 3 weeks of home physical therapy, and you might not even go to outpatient therapy. Now, they might refer you for outpatient therapy if you're having issues with stability or mobility or strength, and all of that depends on kind of how you were prior to surgery and how you are feeling afterwards. So when it comes to golf, you can typically start putting and chipping maybe around 4 weeks. From there, as you're comfortable, you can start to do longer swings and eventually start driving. Just remember, no two hips are the same, no two people are the same. So there's no strict timeline to stick to. Just because one of your buddies got better in 3 weeks, it might take you 6 months before you start golfing. So just do everything as you can. If you have any questions as far as gearing up for your hip replacement or rehab after the hip replacement, please reach out to me. I'd be happy to help.
All right, Belfair, it's good to be back, and today Emily and I, the trainers, we are going to be going over our three-part series, today being our hips. So if you are either approaching a hip replacement or are post-operation for a hip replacement, the number one thing you're going to do before you start any exercise and rehab program is to get doctor's approval, and once you've gotten that, you're good to go. Send you on your way, and let's strengthen those hips. So for hip strength, we're going to focus on 2 movements, but primarily we're going to focus on lifting this leg up and squeezing what's called our abductor muscle. That's abductor. So anything where you're moving laterally is going to be the best thing for you. So for a good exercise we like to use, those are band walks. So Emily's going to go ahead and put those bands around her legs, putting her feet in between. You can either put these at the ankle, below the knee, or above the knee. So right there, Emily has them around her ankles. She is going to walk just to the side. Let's go ahead and see it. So wide steps, wide to close, wide to close. You're going to want to do those in both directions. All right, so those are our band walks. You're going to want to do those for higher reps, like let's say 12 to 15. Over here at the fitness center, we have different colors of bands with different resistances, and those go from green being your lightest, red and blue being like a medium level resistance, and then purple and gray is getting into your heavier ones. So start low with the bands, and then as you get stronger, you're going to notice that the light ones are too easy. That means that you're going to want to get into the purple and the gray. So now that we did a strengthening exercise, Emily's going to go ahead and show us what we can do to stretch the hips. So when you have a hip operation, you're going to want to make sure that you avoid a lot of crossing over. So a good alternative is to use a foam roller and almost massage that area that can give you discomfort and that can be really tight on the side that doctor went in on. So here Emily's going to go ahead and position her body on that foam roller. She's going to turn on her side. And she's going to put a little bit of pressure on it, just to the point to where you get slight discomfort. And she's going to roll on the side of her leg and her IT band. You're going to want to do that for about 30 seconds, 45 seconds, depending on how tender it is. And once you feel like you've had enough, go ahead and you're good to go. And do that, I would recommend probably 2 to 3 times per week.
All right, so now we know a little bit more about the hip joint itself from our health team, and then our fitness team shared with us some ways we can strengthen and condition those hips of ours. All right, so let's talk about some workarounds. Maybe we have some limitations in our trail hip, which would be the right hip for the right-handed golfer. All right, we'll talk about the backswing first. Maybe I can't get a full turn here. My mobility is lacking. Well, the first thing I would do is ask you to flare out that right foot of yours. The more I flare out that foot, the more mobility I have, the bigger range of motion. Also, at setup, we can slightly drop that right foot back a little bit, once again, to help improve with the quality of this motion in our backswing. Okay, and remember how important setup is. So if we get into a bad habit of, at setup, having our right hip higher than our left hip, it's going to restrict that motion, as well as turn it into this reverse spine. Okay, so I want you to experiment with having a little bump here. Left hip slightly higher than right hip, head behind ball, turning from that new position, once again, to improve the quality of motion in your backswing, as well as improve the health of the spine at the top of your swing. All right, so now let's talk about this downswing of ours with this trail hip. Again, if I struggle with some mobility or some pain here, I'm always asking you to get off of that right foot of yours. All right, fully release that foot off the ground, even if it means that you might drag that foot a little bit. All right, now let's talk about our lead hip, or the left hip. Again, ways to improve the quality of its turn in the backswing. I would ask you to unweight that foot. Let it come off the ground. Let that knee work slightly inward and down to improve that range of motion. Okay, also experiment with stance width. All right, so the wider I get, the more I'm going to start swaying and sliding. All right, narrow up that stance to improve the turns. All right, and again, you can flare out that front foot of yours to help improve the quality of that motion in your follow-through. Okay, so learn more about your body swing connection. Come visit us. All right, we're all about supporting you, your golf lifestyle here at Belfair, and we're all about health and longevity in this great sport.